Our next presentation will be Mr. Alfred Gilchrist. He's the CEO with the Colorado Medical Society, and he's going to be presenting Reengineering Physician Engagement Colorado Style. Mr. Gilchrist has been the Chief Executive Officer of the Colorado Medical Society since February of 2010. He also served as the Chief Executive Officer previously of the California Medical Association since 2009. Previously, he also served as the Executive Officer of the Colorado Medical Society for 5 years until September 2009. So without any further ado, Mr. Gilchrist, thank you for joining us.
Welcome to Colorado and to Keystone. They had the wrong introduction. Those things are true that he said about me, but I actually have a little deeper experience representing physicians. I was with Texas Medical Association for 25 years and had a wonderful experience in Texas. And I've been the chief as a lobbyist, and then I've been the executive director of the Colorado Medical Society now for 10 years. There's a couple of people that are here with us today that I'd like to recognize. One of our physician leaders, the chair of our Committee on Medicaid Reform, Dr. Deb Parsons, is with us. And Deb, if you'd raise your hand, I appreciate you taking time from your schedule to be here this weekend. And my old friend from Texas, Dr. Tom Garcia, who is the current president of the Texas Medical Association and always made the staff feel valued and special in his participation with us, is on site this weekend. And it's great to see Dr. Garcia. The purpose of my presentation is to tell the story of how one state medical society, the Colorado Medical Society, is moving forward consistent with the values of Let My Doctor Practice, and that's to mobilize and engage physicians to create a unified voice for responsible change. Let me introduce you to some of my officers, my elected officers. We have a diverse group here in Colorado. Front right is Dr. Mike Voles. He's private practice, allergy and immunology. He's been active with us for 25 years. Every 2 weeks after practice, him and his wife load up and drive 275 miles to western Kansas, where for the last 18 years they've been serving rural western Kansas as the only allergist and immunologist. So he's a country doctor and he's a city doctor. And in the back left is Dr. John Bender. He's been involved with us for about 8 or 9 years. He's immediate past president. He took a one practice setting, bought it when he got out of the military, and he now has over 120 employees, multiple settings, and almost 20 healthcare professionals working for him. He will soon be going totally direct primary care. And in the middle is the youngest and the first of color to be the president of the Colorado Medical Society, and he's an internist and a family medicine physician who practices in rural Texas. All three of these doctors have been through extensive leadership training. At the Colorado Medical Society, we put a lot of emphasis on our students. One of the reasons we do that is because of a gentleman that's here in the room today that served on the board of the Colorado Medical Society for many years, Dr. Rip Hollister. And Rip, it's great to see you here today. We love the students, the board, the staff. This preceded me at Colorado Medical Society because they energize, they're excited, they're fun to be around. They love to learn from physicians in an off-campus setting. And it's a great way for us to develop future leaders for organized medicine. Our values underpin everything that we do at the Colorado Medical Society. And for the last 18 months, we've been focusing on organizational excellence and reforming our organization. And believe me, participating with the physicians in this process has taken a lot of leadership, collaboration, and professionalism and transparency to do what we've been doing over the last 18 months. These are our goals. We have 5 goals at the Colorado Medical Society. We want all physicians to thrive personally and professionally throughout their careers, and we want innovation that will result in access to high-quality, cost-effective, and safe care for patients in Colorado. And we want an organization that stands up for physicians and represents them and their profession. So there are two things that really brought me here today during my family vacation, which 15 miles away over at Breckenridge, my nieces and nephews are fishing and waiting on me to return to the vacation. And if you haven't vacationed here in Colorado, you need to come on up because there's so much to do in the mountains. But there are two reasons that I broke away from my vacation to come and be with you today, because number one, I had an opportunity to visit in my office with Dr. Michael Strickland, who is active in Let My Doctor Practice. And Dr. Strickland is actually from rural Texas, and I've pheasant hunted quite a bit in the community where he grew up. We had a great time talking, and I liked his vision that Let My Doctor Practice is not about dividing, it's about uniting, it's about fixing problems and not assigning blame. It's about bringing people together, organizations that represent physicians and individual physicians to improve the health of the American people. I thought that was a great vision, and I liked it. And the second reason that I came is because I like what's on this slide. We'll mobilize, and this is part of the mission statement of Let My Doctor Practice. We will mobilize and engage physicians to create a united voice for responsible change. This has actually been my passion for 36 years. It's what all of us do, whether you're a physician in a leadership role in a state medical society or a state specialty society, or you're a staff member, because we all understand that when physicians are mobilized and engaged and unified around a goal, it's not just good for doctors and patients, it's good for America. It is good for people in a state. And all you have to do is look back at your history and look at the remarkable and wonderful things that you have done and that your profession has done. And that is what keeps people like me and the people that work for you fired up, because we have all been involved when it has come together and it has worked, and it is truly thrilling when it happens. So let's take a look at the barriers that we face to uniting and bringing together and organizing. I couldn't have written these barriers any better. Dr. Craviotto, who is a past president of the sponsoring organization, who's a past president of the United Physicians and Surgeons of America, actually wrote these. I took these from one of his articles because they're absolutely true. And this is the barrier that Let My Doctor Practice, the American Medical Association, your state medical society, your state specialty society, this is the challenge right here. If we can eliminate these barriers, we can do great things because we have done it before. Did you hear what I said? We have the power. We do have the power, but we have to overcome and eliminate these barriers in order to find that power to improve the health of your patients and to improve your career as a doctor. At our Colorado Medical Society, we want to exercise that power. We understand that we're in a time of great change. And to exercise that power, we have identified and addressed our internal barriers, or we are in the process of doing that. We must recognize and understand our changing environment and the nature of change within the medical community. And we must assess what we do and how we do it, and then decide how we are going to do it better. In our assessment at the Colorado Medical Society, which has been ongoing now for 18 months, we've retained governance experts, we've retained communications firms, we have focus grouped, we have polled, we have listened, we have talked, we have debated, we have been around and around. But in our assessment, we found one, even as medicine confronts practice-crushing disruptions and an urgent need to come together as a community of common purpose, we find a significant narrowing of physician participation in our century-old governance model. Two, despite an enviable track record of public policy and advancements and wins over the last decade, we found that the few who carry the many in our organization are simply getting fewer. Three, the evidence drawn from extensive research and peer-to-peer conversations across the spectrum of practice settings led us to conclude that our brand is deteriorating. Four, our House of Delegates participation keeps declining. And five, our members are seeing what they believe to be less relevance. With the findings in and recommendations completed, our board of directors 1 week ago today, last week, voted to shift our business model. This is not a shift in our values, our purpose, or our vision. The shift is in how we govern and communicate, and it will be a primary focus on advocacy. I'm excited about it. We're all looking for the secret sauce. I'm not even implying that we found it. We are leaning into the change because we are a learning organization. And forums like this give us an opportunity to learn from one another. So I'm particularly grateful to be here with you. This slide indicates what we have known since 2008, that our members look to the Colorado Medical Society for two things, and two things almost exclusively, and that is advocacy and communications. And what we've been doing for the last 10 years that I've been here is we keep trying to give them other things, more, different things, the latest thing. And what we do is we diffuse our staff and our leadership, and what we do applies to fewer and fewer doctors. And so as we surveyed and as we listened and as we talked and debated, we said, you know, let's just admit it. This is what they want. They want advocacy, and they want to have bilateral communications. They want to engage, but they want to engage in a different way. So what will the next generation Colorado Medical Society look like, assuming that our House of Delegates passes all of this in September? First of all, we will put members first and promote the profession, first and foremost. We will engage physicians across the spectrum of practice settings in policy development and advocacy. We will draw on expertise from the exam room level to the boardroom to the hearing rooms of the state government, and in that order. We will link a streamlined board of directors' actions to their grassroots counterparts. We will provoke vigorous, evidence-based, peer-to-peer evaluation of the policy options before this Colorado Medical Society. And we will aggressively incubate and cultivate a farm system of physician activists and leaders that reflect the evolving demographic and diversity of Colorado physicians. Here's a few details on how we're going to do this. Once again, if it's approved by our House of Delegates. Number one, we will put all policy-making authority in an 18-member board down from a 36-member board. We will remove policy from the House of Delegates and keep the annual meeting in a family-friendly, collegial format that focuses physicians on critical issues of importance to the profession and on unity. The board will be directly connected to our members through a virtual grassroots policy forum. The virtual grassroots policy forum will allow physicians to engage with CMS on a 24/7 basis by 1, submitting policy ideas, 2, providing input on policy ideas submitted by others, 3, providing the board with input on policy decisions before the board votes, and 4, giving the board input on the policy decisions that they make after they vote, and if a majority of those that are giving the input don't like it, the board will have a policy that the decision will automatically be put back on the agenda for reconsideration. In addition, the virtual policy process will communicate with physicians on their terms and on the issues they are passionate about. The system will be easy to participate in, and it will be fun. We're not going to try to make them come to a meeting anymore. They can come if they like to. We're not going to get rid of in-person. But there's a whole lot of doctors out there that are saying to us in our surveys, we will be more engaged with you if you will meet us on our terms, not on yours. We will go to all member elections for president-elect and AMA delegates. We will run 2 leadership schools. One, we're already running, is an advanced leadership program composed of 4 weekend, off-site, no spouses, intensive training. The second will be a skill-based course for the explicit purpose of medical society leadership development. We will become the authority on Colorado physicians by annually surveying our members and the external environment. Along with what we learned from the virtual grassroots policy process and in-person listening sessions, we will make this information available to the media, the executive and legislative branches of state government, and other important stakeholders. Our annual research project will drive our advocacy and our educational efforts. We will further test our brand to determine if it is only slightly tarnished or if it's in need of a remake. And if it is, then we're going to rebrand the Colorado Medical Society. We will stand up and fight for our members when collaboration has been exhausted. CMS is leaning into the future. We're a learning organization. Every state medical society in the country is looking for that secret sauce. You can stay tuned and we'll keep you posted on our progress, and where it's mutually beneficial, perhaps we can hook up on a project and make progress together. This might sound a little corny, but to get ready for this talk, I Googled up timing quotes and timing symbols, and these resonated with me. Never in my 36-year career have the challenges been greater, and more today than ever before. Effective physician leadership is needed. Let's break down the barriers or eliminate the barriers that Dr. Cravito wrote about in his article, and let's find that responsible change for a better, healthier tomorrow, the vision of Let My Doctor Practice. Thank you for having me, and I'll be happy to answer any questions.
Alfred, I just wanted to say thank you so much for joining us. We really appreciate it. And also for your help in letting Colorado physicians know about this event. My question is, this experience of forming this conference has really educated me on the statement that the states are the laboratories of democracy. And I think it must be tempting sometimes, if you want to address an issue, to just go on the federal level and let's just do it all across the board and save having to go around to the various states. But like I said, it's really impressed upon me the importance of that part of our democracy. So in terms of the medical societies, how can the state medical societies, which are in a great position to address problems within their borders, how can they collaborate to help address issues on a more national level as well?
Well, there's a number of ways that can happen and that it does occur. Not necessarily in this order, but there's great collaboration through the American Medical Association, where the physicians belong to the House of Delegates and help to create the policies of the AMA, and then the state medical societies and the AMA work together to try to, pass or to prevent the Congress from enacting certain policies. In addition to that, states can initiate their own activities with their own congressional delegations. All politics is local. I think Sam Rayburn was the one that said that. And personal relationships are the most important thing in the body of politics. Many, many times in my career have I seen state legislators, the United States senators, Lloyd Bentsen included when he was chairman of Senate Finance, respond to a physician who he knew personally. And because, some, actively practicing rock of the community doc in that district or in that state who was engaged with that elected official brought an issue to him or her, decided that they were going to stand up and fight for it. So state medical societies, can collaborate with one another and their own congressional delegations. They can work through the AMA. But the key to this whole thing, Dr. Strickland, is having physicians involved and to understand that they, as a white coat involved in the political process, just automatically bring, more credibility because they're a physician. And when they get to know, politicians who become, candidates who become elected officials and develop personal relationships, the ability to make change is, greatly enhanced. It is the most powerful thing in politics that I've ever witnessed. Good question.
Thanks.
Tom Garcia from Texas. Alfred, it's so good to see you here in Colorado, and I appreciate you doing the sacrifice, coming over the mountain to come talk to us. I'm interested in your comment about the board, the makeup of your board, and how you reduced it. Could you go into a little bit, without getting into too much detail, how are you able to do that with all the stakeholders involved?
Well, first of all, whether this becomes a reality will be determined in 2 months right up here in the mountains when our House of Delegates meets. But I think there's a couple of things that kind of come together. First of all, there's the literature about board size. And, there's a lot of literature out there that demonstrates that the larger the board, the less responsible any individual on a board feels. And it's much easier for a board member to, decide that they're going to go skiing or go do something else, instead of make that board meeting and, it's just kind of okay. But the smaller the board, the more responsible the board members feel. A matter of fact, the latest literature that was developed by the American Society of Association Executives, which is the organization that, this is my organization, the book that's most recently written says that the ideal board size is 5 to 7. Now, we we put that on the table, and it was rejected pretty quickly. And 18 is a compromise. But I think that the other thing that in our situation that came along with the literature and what the literature says about board size is the idea of the grassroots virtual policy process. I don't know of anybody in the country that's done this, but I'm sure that you're familiar with crowdsourcing. And actually, I was working with two physicians. Both of them were past presidents. Both of them are in their 70s. Both of them have grandchildren. And both of them are great on the computer. And this was their idea. And they were saying, Alfred, there is no reason in the world that we can't, allow physicians to participate at their convenience and in the way they want to and on the issues that they're passionate about through through a well-built computer program. So we flow-charted it, and we've let out an RFP, and we've been, interviewing computer software companies. And, we got 3 of them ready to sign right now. So I think if the House of Delegates buys this, they're going to buy it because they're going to understand that the virtual grassroots policy forum is going to actually give all doctors, not just the delegates, but all doctors an opportunity to participate throughout the year, 24/7. And that's going to be a big factor in whether or not we reduce the board size.
Hi, can I just ask, is it possible to give your contact information live and on the internet if any other medical societies want to follow your model that's very, very ground up as opposed to top down, which most of them seem to be these days?
Yes, it is. And I just wanted to make a comment about bottom up versus top down. There's a lot of data that I could show you because we ran a number of surveys over the past 18 months. But one of the surveys that we asked is we defined, what a organization like the Colorado Medical Society is, and we explained how it's governed. And then we said, how do you view the Colorado Medical Society? Is it bottom up or top down? And, it was, 60-40 top down, bottom up. And we said, what do you want it to be? And you guys are really smart. They said 50-50. We get it. We get that somebody's got to make the decisions, right? Somebody's got to have the fiduciary duty, but we want in on it. And it was just solid 50-50, the numbers that came back. And the other set of numbers that came back was that we defined engagement. And we said, who are you? Really engaged, somewhat engaged, a little bit, and not very. And we created definitions for those. And we said, if we reformed ourselves and we gave you an opportunity to participate and to engage with us on your terms, not on ours, who would you be? And those numbers went up 6 and 7%. That's a lot of doctors. You're not ever going to get to full engagement. That'd be awesome. But if you can increase your engagement by 5 and 6% in those categories, you're bringing a lot more intellectual capital and ideas and passion into your organization. So my name is Alfred Gilchrist, and my email address is Alfred_Gilchrist, GILCHRIST @cms.org. And the CMS, of course, is for Colorado Medical Society.
Not to be confused. Thank you very much.
You're welcome.